So I took great care to present information that I feel is based in science, and I included the sources for where I got the data whenever possible. And just a shout out to Dr. Fauci, who has been one of my mentors for over 20 years. I think he is the basis for a lot of the information that I have, as well as the CDC. Okay, so globally, yesterday, a grim milestone was passed. Unfortunately, we reached 1 million global deaths. Half of these deaths are from 4 countries: US, Brazil, India, and Mexico. I don't know if you guys have seen this Johns Hopkins website. You can just Google Johns Hopkins University COVID, and like many websites, they will have like updated statistics. So this is one of the most robust ones out there that aggregate global information. And I remember in March when I was watching the numbers, and I haven't looked at it in a while. And then when I got on here last night at 8:15, I was sad to see that we did pass the 1 million mark of deaths. And you can see on the left-hand side, these are cases, and US is leading the way with 7 million cases. So that's globally. Nationally, this is data from last Friday at 8 in the morning, and this is a case rate. So this is accounts for the population, because we know some states have more people than others. But if you look at per 100,000 Americans, this is the death rate. And you can see some of the states that have higher rates, really the southeast part of the United States, the eastern seaboard, and then a few other states spattered throughout. So just wanted to share that. And then what's happening on a state level. So this is in the last 2 weeks, an update on September 17th. Governor Abbott did loosen a lot of the restrictions that we previously had in place since July. One of the main ones was increasing operating capacity from 50 to 75% in restaurants, retail stores, and office buildings. We now can reopen museums, libraries, and gyms. Nursing homes can reopen for visitations with certain visitation standards. Hospitals are now allowed to offer elective procedures. Not yet ready to reopen bars. And the governor said he'll be looking at hospitalization rates and capacity, and basically set a threshold of COVID hospitalizations where the threshold is 15% of total hospitalization. So if we get to over 15% of a hospital capacity of COVID, then we would start to think about tightening up some of these restrictions again. For Austin Travis County, if you go to their website, really great dashboard. This is the one I look at most frequently, which looks at hospitalizations, ICU capacity, ventilator capacity. And so you can remember back to July when we were in the red and we had over close to 100 admissions a day in the hospital. Many of them were getting to their capacity in the ICUs. And then you can see how we've done a lot better. There could be, and some days it looks like we're upticking with maybe the opening of schools. It looks like the uptick may be mostly from young people, but so far and that's with cases, but as far as hospitalizations, that has looked pretty good. And then in our homeless community, I just want to think back to March when this was a study published in morbidity mortality report that's published by the CDC. This was May 1st. And they had looked at 1,192 residents in 19 shelters and really looking at what is the incidence or prevalence of COVID in these high congregate settings. And this was astounding that in Seattle it was 17%, Boston 36%, and San Francisco as high as 66%. And this is the study that really helped us understand that congregate living facilities are one of the highest risk environments, which would include jail, nursing homes, shelters, even now cruise ships, and even we could add Austin to this. When we went into one shelter and tested, the positivity rate was 39%, so we were right up there with the other shelters. And then since August, a lot of these cities have reported that, because of all the precautions that we are now taking with screening at the front door and physical distancing within the shelter and hand washing stations, that most cities are reporting that none of these kind of outbreaks that we saw early in the pandemic. So that's really good news. But because of the studies, the CDC recommended that given the high proportion of positive tests in shelters and evidence of pre-symptomatic and asymptomatic transmission, testing of all residents and staff, regardless of symptoms, should be considered. And that is why we're doing what we do today. So there's the surveillance testing. If we found a cluster of cases, we go in and test. And then we do the mass testing. So we do periodic testing in high-risk areas such as downtown. Our last one was September 14th. I don't know if some of you guys participated. We had 1 out of 100 positive, and that was a staff member. And prior to that, I think it was 6 weeks prior to that, we had 4 out of 100 that were positive. And all of those were staff as well. So far we've been able to keep things at bay, which is good. And we will continue to do our mass testing. So just to review modes of transmission. So the main one is respiratory droplets, and that's just basically coughing. And you can see the respiratory particles that basically get coughed out and then travel to the host who will be infected once it touches their mucosal surfaces. Contaminated surfaces has also been a way of transmission. We don't know how much how much of that is involved with our positive cases, but it's always a risk because we have found positive virus on surfaces up to 48, 72 hours. So that's why we want to be very vigilant about cleaning and sanitizing surfaces. And then more recently, we've learned that airborne aerosolization of these particles is also possible. And not to alarm anybody that these particles are floating in the air at all times. The idea is that we previously thought that if you coughed, at most you could travel about 6 feet. We now know that some of these smaller, tinier particles may be airborne for a small amount of time. And that's why the mask is so critical to curbing this pandemic. Bodily fluids, we found the virus in blood and stool, but we just don't know what role that plays in transmission. And then we believe that animals are not a major source of transmission. So I thought this was a pretty cool, fun slide to help you appreciate the kind of droplets that are released when you sneeze. And you can, if you just Google like a slow motion sneeze, you can find this, and this is actually a video. But we also know that in addition to sneezing, that you can release particles by speaking and even by singing. And that was what we saw in that choir back in March, where one person infected 76% of the choir while they were all singing. And so in terms of prevention, we now know that the personal preventative measures are very effective, and not to, I know that COVID fatigue is setting in, so I just want to keep reminding us that everything is working, it's all good, and I just keep doing what we're doing. Diligent hand washing, avoiding close contact, covering your mouth and nose with a mask, cloth, face covering your sneeze and cough, avoid face touching, and then regular cleaning and disinfecting of frequently touched objects. So public health measures are also working. These include social physical distancing orders, stay-at-home orders, school venue and non-essential business closure, bans on public gathering, travel restrictions with exit entry screening, aggressive case identification and isolation, and contact tracing and quarantine. So just to remind us that these public health measures that have been broadly adopted are also very effective and continue to work. Okay, so we know that the mean incubation for COVID is about 5 days, and then it can be anywhere from 2 to 14 days. But on general, 5 days. To remind you of the symptoms, cough, shortness of breath, fever were the main 3 that we knew of in the beginning, and since then we've expanded to muscle aches, vomiting, diarrhea, and then this really unique one of loss of taste or smell. And so you can see that a lot of these symptoms look like the flu, and it can be very tricky. And then about half of the cases of transmission have been asymptomatic. And that's what we saw in Austin. When we tested at the one shelter in March, 39% positivity rate, 50% asymptomatic. So what we saw was definitely consistent with what is being studied as well. And just, I thought it was interesting if you wanted to see what are the most common symptoms. So fever, we've seen in 83 to 99% of cases. So that really is the #1 symptom. And that's why taking temperatures have been so critical for, when you're entering clinics, when we enter the shelter, we've been doing that, and for good reason. And then cough, fatigue, anorexia, shortness of breath, myalgia. So those are the top 6 symptoms that we're seeing that most correlate with COVID, although many of these others can occur. In terms of temperature, we use 100.4. With that being said, I had a patient early on that was like 99.5. So I would say, 100.4 is definitely the cutoff, but something that is lower that with other symptoms would also be suspicious. All right, so spectrum of disease. So we know that for the most part, 80% of people will have a mild to moderate illness, but that's not to mean that we shouldn't take this seriously, because about 20% will have severe, and then 14% will have severe, and then 5% critical. And for those who are critically ill and often on ventilators, the case fatality, so the death rate is 2.3%. So it is something that's been perplexing to scientists, why there has been such a wide range of severity with COVID. And so I just want to remind us that there is definitely severe, and that's what we see in the hospital. But sometimes we may become numb to it because we see so many young people who do fine, and many people say they didn't feel that bad. And that may be true, but there is definitely a subset that don't do well and get very sick. And so that brings me to the next slide, that we have now identified several illnesses that are associated with increased risk for severe COVID illness, hence the prologes that were created by the city. So serious heart conditions, chronic kidney disease, COPD, diabetes type 2, obesity, cancer, sickle cell, and immunocompromised state from any organ transplant. Interestingly, recently, the scientists have said that obesity has actually been one of the most common associated conditions, and that's with a BMI of greater than 30. Some underlying conditions that may be associated with severe COVID illness, data is not quite there yet, but definitely an association, and many of us believe this to be true. So asthma, other chronic lung diseases, cerebral vascular disease, stroke, diabetes type 1, hypertension, that one certainly I would put on the other list. Immunocompromised states like HIV, if someone's on chronic steroids, liver disease, pregnancy, smoking, neurologic disorders, and inherited metabolic disorders. And what's interesting, if you look at the population of the United States, and you looked at how many people in the United States have any of these one conditions, that would be 40%. And not to say that everybody will, is that high risk, but it just goes to show that, there are a lot of risk factors, many of them in our population who, why is the homeless at higher risk? Because they have a lot more chronic conditions. They tend to be older. They tend to be in congregate living facilities, and they can't do a lot of these public health measures that we talked about, like social distancing and being able to quarantine and isolate if they want to. So anyway, those are some of the conditions. So testing, just wanted to review this really quickly as you'll hear more and more about it. So the testing that we had from the beginning of the pandemic was the molecular tests, the first panel, and that basically we're looking for genetic material from inside the virus. And because it is more costly, it takes longer, but it is highly sensitive and specific. So it is the most accurate test. And this will be obtained through a nasal swab, through the nose or the throat. The other type of test, and that'll tell you if you have infection. The other type of test that we're hearing about are these rapid antibody tests. And what we're looking for there are particles of the virus, which often will be on the outside. There's a lot of different particles. This one is the spike protein. And this test can be done very quickly, in 15 minutes, rapid test. It is, again, also a swab from the cheek, from the nose, throat. So very fast, very cheap, but not as accurate. And then the last one is the antibody test. So the first two tell you if you have it, and then the last one tells you if you had it. And so here we're looking for antibodies, which is your body's response to the virus. You're going to create these antibodies. It's a blood test. And we just don't know enough about this yet. We don't know if you have antibodies, are you totally immune? If you are immune, how long you are immune for. So that's something we're still learning. We are using antibodies from people who have previously been infected to treat people in the hospital, and we are finding good results with that. But I think there's more to come through more research on that. And then vaccines. So not to give you too much scientific information, I just really want to show this because it just to show that there's a lot going on. There's a lot of different companies working on creating a vaccine. Many of them have had successful phase 1, 2 trials and now in phase 2, 3. So there's 3 that are already in phase 2, 3 trials. And for that reason, Dr. Fauci and many of the experts in our country and in the world believe that we will have a pretty good vaccine by the end of this year, if not early next year. Now, how we're going to distribute it is a different question, and how good it is another question. But at least we know that that we hope to have something, and that there is a light at the end of the tunnel. And I end with this because I just want to say that we are all suffering from COVID fatigue. This has been going on for a long time, and it's affected us in many different ways for ourselves, for our patients, and it is exhausting. As I just want to say, there's an end to this. There will be a vaccine. We can do our part by preventing surges, and we can do our part by turning around surges, which I think will continue to occur. And just remember that we are all in this together. So these are the recommendations that we had last time. Not a lot has changed, but just to reiterate that we want to continue screening. It does work. We want to continue wearing our mask. Think of that slide with that slow motion cough. It does work. Physical distancing, it does work. I always try to imagine, I tell my kids, think of these little particles in the air. If you stand further apart, that won't, enter your space. So that's also working. And then if someone's symptomatic, we need to get them isolated and tested if possible. And then, with the last mass testing that we've done, it's been interesting, and I think other cities could report the same, that it isn't as much as individuals staying in the shelter that have been positive, but the staff, and that makes sense. I mean, we are also, doing our work, but also doing other things in our community, and so we just need to remind ourselves that we also have to practice good social distancing when we're away from work. And then we don't recommend testing again, at doing another test if someone's been positive. And then just the reminders for how long to quarantine or how long you're symptomatic. And then just a plug about flu shot. So why is it important, especially in this time of COVID? I'll give you 3 reasons. The risk of overwhelming hospitals. So if hospitals and ICUs are full of COVID cases, then even a mild flu season could overwhelm the hospitals. And so we're just not only are we worried about people coming in for COVID, but if you're in a car accident or if you're having a stroke or something very serious that you need to be in the hospital for, we want to make sure that there's space for you. So if we can prevent people from being hospitalized for the flu, we would love to. And just to say, last year, according to the CDC, there were 500,000 people hospitalized for the flu, 34,000 deaths. So testing could be strained. I didn't know this, but we use the same reagent for COVID tests as we do for flu tests. So if the demand for testing goes up, we may have a reagent shortage. And I know that last flu season, we tested so many people for flu that we actually ran out of flu tests. So you can imagine that if we're going to be using a lot of testing for flu, we will then run out of COVID tests too. I think there's some things that are in the works, but until then, we are using the same reagent. And then the last thing is you just don't want to have both at the same time, and it is actually possible. We don't know really the damage that can happen, but we do know that both flu and COVID target the lungs. So you could imagine that if you're getting a double whammy, that could double your damage. And again, we don't know for sure, but you wouldn't want 2 things really attacking your lungs at the same time. So according to the CDC in 2018-19, only about 49% of Americans received the flu vaccine, but those 49% who did, they estimated that they were able to avert 4.4 million illnesses, 58,000 hospitalizations, and 3,500 deaths. So the right time to get the flu is now, vaccine is now. This is early in the season to protect you for as long as possible. So we definitely want to get that if you can. All right, so that's all I have. I'll take any questions if anyone has any.
Looks like we have a question in the chat from Juliana. It says, how would you recommend we help our uninsured clients obtain flu shots?
Yes, I don't have all the facts, but I know that Austin Public Health has a great flu vaccine campaign. And I again, don't know all the details, but in the past there have been, they have come out to the shelters to vaccinate, and they are in a lot of public spaces to make sure that people are getting vaccinated. So I can certainly get more information on that. And I don't know if anyone on the call has anything else that they know about, but I know Austin Public Health does a great job with that. And so let me get some more facts for you for that. And yes, Michelle said that APH is developing an adult outreach for flu shots. So yeah. Have you heard anything about the flu vaccine either potentially being protective for COVID or mitigate? Yes. So yes, we've looked to some of the Southern Hemisphere countries, particularly I feel New Zealand or Australia, Argentina was another one. And it was exciting to hear that they had a lower flu season than in the past. And they attributed it to people wearing masks and social distancing. And so the things that work for preventing COVID also work for preventing flu. So that was exciting to see. And so, I think we want to be cautious, and that is something in our favor, that maybe we will avert more flu because people are doing all the things that we should be doing to protect ourselves for COVID and now the flu. On the flip side, I think people are worried because the cold will put more people indoors. And when we're indoors, we won't be able to, then the idea of these contaminated surfaces, aerosolization of particles, people being in more closed spaces could increase flu and COVID. So I think there's some potentially beneficial things and then some concerning things. And I think we'll just have to wait and see, but we want to do all the things that we know will be preventative that we can.
Those were two really great questions, Jill and Juliana, so thank you for asking those. Does anybody else have any additional questions they want to drop in the chat, or you feel free to unmute yourself and ask Dr. Kwong? Looks like we have one from Michelle Miles. What recommendations would you suggest to stop the spread during the fall and winter months?
Oh yeah, good question. I think, yeah, I will say I don't have any formal opinions. All I know is what public health experts tell us. And so the fall and winter is going to be concerning because we will be more indoors and won't have the chance to physically distance. And I think being in Texas, we are a little bit luckier than being in a state where there's more snow and freezing temperatures, where we would, be able to be outdoors a little bit longer. But yeah, I think the same things of wearing a mask and washing our hands, all the same things. And just knowing, and the flu shot is what I ended with. But just, I know with the flu, people are, if you have it or any virus, you're going to be sneezing more, whether you have COVID, you could be asymptomatic. All of those things worry me. And so I'd say flu shot would be something for sure. And then my hope is that with the city, we will have some things in place, like you mentioned, for the flu shot, but also for people to have some more shelter if they need it, and that we're not, I know in the past we've packed people into Arch and other cold weather shelters. And so my hope is because of with the winter coming that we will have some more options for folks to stay away, to stay warm away from the elements and not get sick. I had a lot of patients personally in the last year who had frostbite, who got pneumonia from being outside in the elements. Many of them had to go to the hospital. So along, again, the same themes of keeping people out of the hospital, because we really need to maintain that capacity. If we can keep people safe, so that they don't get pneumonia and don't get frostbite and a lot of their chronic illnesses don't get worse, then that will be better for the city in general. Oh, yes. I have seen some things about HEPA filters. I don't want to speak out of turn, so I will tell you I will look that up and maybe come back with some answers next time. But you know, it was interesting. I heard Dr. Fauci give a talk 2 weeks ago to Harvard Medical School, and he said that, you know, in the past, when we thought about these virus particles, that we thought anything over 5 microns would stay on droplets and then drop to the ground, and that was the cutoff. And what we've learned recently is that we were wrong. That physicists are telling us that these little particles can actually stay in the air a little bit longer, and that we thought, you know, if you're away 6 feet away, that you should be okay. We actually now know that, believe that it might be, you need to stay a little bit further because those aerosolized particles could actually travel further than 6 feet, which is why the mask also is good. And as much as you can keep things ventilated and filtered is good, but I don't know what formal recommendations have come out. So let me look that up. And get back to you. That's a great question. I think we're out of time. So I appreciate everyone who joined us today. And if there's any other questions, I think Krista's taking them for the next one that we hope to have in 2 weeks. And is there anything else?
No, thank you so much for your time, Dr. Kwong. I really appreciate, I know you're very busy, so I really appreciate that. And I know everyone's busy, so thank you all for being here. And if you have any questions, please feel free to email those to me so we can get those prepared in advance. And yeah, thank you so much again for everybody being here. Y'all have a great rest of the day.
All right, bye, stay safe.
Thank you, Dr. Kwong.